Welcome to ScrubNotes, What to Say in Clinical Encounters. Whether you're heading into an OSCE, starting rotations, or just trying to feel less awkward talking to patients, this podcast is here to help you sound more organized, more confident, and more natural with patients without memorizing long scripts. I'm Kate, a medical student, and I break down simple, repeatable frameworks so you know exactly what to say in real clinical situations. Each episode is short, practical, and focused on one specific skill, with examples of what to actually say in real encounters so you can use it right away. All right, let's get into today's skill. One of the hardest parts of OSCEs isn't knowing the medicine, it's knowing what to say. You know the differentials, you know the workup, you studied the pathology. But then when you walk into a room, you're suddenly trying to figure out, how do I actually say this out loud? A lot of students, myself included, freeze during transitions, struggle to explain your assessments clearly, or sound less confident than you actually are. And usually, it's not a knowledge problem, it's a communication structure problem. So, in this episode, I'm going to walk you through a simple OSCE communication framework using practical soundbites you can actually use in patient encounters. The goal isn't to memorize a giant script, it's to sound organized, confident, and professional under pressure. One thing I've noticed in medical training is that students are taught what questions to ask, what diagnoses to consider, what tests to order, but very few people actually teach how to communicate all of that smoothly in real time. And because of that, a lot of encounters end up feeling awkward, abrupt, disorganized, or overly scripted. You might know exactly what you're doing clinically, but if the communication feels scattered, OSCE examiners notice it. And honestly, patients notice it too. That's why frameworks matter. Because when your brain is stressed, you need structure, not perfect memorization. And that's exactly where the Connect framework comes in. Throughout this podcast series, we've been building communication skills using the Connect framework. Connect helps you guide the patient naturally, transition more smoothly, avoid awkward silences, and sound more organized during encounters. So today, we're applying the same principles to the overall structure of an OSCE encounter. Because great OSCE communication usually follows a predictable flow. And once you understand the flow, you stop feeling like you have to invent everything from scratch. So step one is to start with empathy. Before jumping into questions or medical terminology, connect with the patient first. Even one sentence of empathy changes the tone of the encounter. For example, "That sounds really uncomfortable," or "I'm sorry you're dealing with that," or "I'm glad you came in so we can take a closer look." This aligns closely with the ease portion of Connect. You're lowering patient anxiety and building rapport. And importantly, this doesn't need to sound dramatic or overly emotional. Simple and genuine work best. One mistake students make in OSCEs is becoming so focused on checklist items that they forget the patient is supposed to feel heard. Even brief empathy statements help the encounter feel more human. Step 2 is to set the agenda. This is one of the highest yield communication upgrades you can make. Instead of immediately jumping into questions, briefly explain the structure of the visit. For example, to start, I'd like to ask a few questions about your symptoms, then ask about your general health, and after that, we'll do a focused exam. Does that sound okay? This is the Connect framework in action. You're giving context, open, and navigate. You're telling the patient what's happening, why it's happening, and what to expect. And the result is that you immediately sound more organized. This also helps you mentally settle into the encounter because now both of you and the patient understand the structure. A lot of OSCE communication points come from simply making the patient feel guided. Step 3 is to summarize what you heard. After the HPI and focused questioning, show the patient you are actively listening. This is one of the easiest ways to sound polished in an OSCE. For example, just to summarize what I'm hearing, you've been having abdominal pain for the past 2 days, it's worse after eating, and you've also had some nausea. Did I get that correct? This step does several things. It confirms understanding, catches any misunderstandings, demonstrates organization, and improves patient trust. This is the confirm part of Connect. And importantly, it doesn't need to be a perfect recap of everything. I think it's good to focus on timeline, major symptoms, and key associated features. Even a short summary makes you sound significantly more organized. Okay, step 4, explain your differential diagnosis clearly. This is where many students panic. You finish the history, you finish the exams, and then suddenly your brain goes, okay, how do I explain this? Well, first, it's completely okay to pause briefly and gather your thoughts. In fact, calmly pausing often looks more professional than rushing. One structure I really like is to say, based on what you've told me and the exam findings so far, the most likely cause of your symptoms is. Then you can follow that with, other possibilities we want to keep in mind include A and B. This is powerful because it demonstrates clinical reasoning without sounding overly technical, and it also shows you're avoiding premature closure and considering alternatives. For example, based on what you've told me and the exam findings so far, the most likely cause of your pain appears to be musculoskeletal chest wall pain, especially since the pain worsens with movement and pressure. Other possibilities we want to keep in mind include acid reflux or, less commonly, heart-related causes, so we'll continue evaluating for those as well. Notice how this sounds organized, thoughtful, and reassuring. You're not pretending certainty, you're guiding the patient through your reasoning. So now, step 5 is where you present the plan clearly. Once you've explained your thinking, transition into the plan. A clean transition phrase could be, to help confirm what's going on and make sure we're not missing anything serious, here's what I'd recommend. Then you can briefly explain testing, treatment, any lifestyle recommendations, and follow-up. For example, I'd recommend focusing on hydration, gentle foods, and rest. If symptoms persist, we may consider further testing. Or the next steps I recommend are rest, anti-inflammatory support, and avoiding activities that aggravate the pain. This is where most students sometimes over-explain, so you just want to keep it clear, structured, and patient-friendly. Because remember, patients don't need a textbook lecture, they need a clear next step. Step 6 is shared decision-making. This is the small step that makes a huge difference. After explaining the plan, make sure to involve the patient. You can simply ask, how does the plan sound? Or, would this plan work for you? This demonstrates collaboration, patient-centered communication, and flexibility, which OSCE examiners really love. But more importantly, it mirrors real clinical practice. Sometimes patients have concerns, barriers, misunderstandings, or preferences, and this step helps create space for that conversation. Step 7 is to provide a safety netting. This is one of the most commonly forgotten OSCE skills. Always tell patients what warning signs to watch for and what to do if things worsen. For example, if your symptoms worsen or you develop severe pain, persistent vomiting, or fever, please seek medical care right away. Or you could say, if you develop worsening chest pain, shortness of breath, or dizziness, please seek urgent care immediately. This shows clinical awareness, patient education, and safe practice, and it gives the encounter a much cleaner closing. This is the tie it together portion of the Connect framework. You're helping the patient leave with clarity instead of uncertainty. Okay, so let's hear how all this might sound in a quick example. Based on your history and exam, the most likely cause of your pain appears to be musculoskeletal chest wall pain, especially since the pain worsens with movement and pressure. However, we want to consider other causes such as acid reflux or less commonly heart-related causes, so we'll continue evaluating for those as well. The next steps I recommend are rest, anti-inflammatory support, and avoiding activities that aggravate the pain. How does that plan sound? And if you develop worsening chest pains, shortness of breath, or dizziness, please seek urgent care right away. So notice how structured that feels. It's not really robotic and not overly scripted. It's just organized communication. And honestly, that's what most OSCEs are looking for. So if you take one thing away from this episode, I hope it's this. You don't need to memorize full OSCE scripts. Whew. You just need reliable communication structures, transition phrases, and repeatable frameworks. Because under pressure, structure reduces cognitive load. And the more often you practice those sound bites out loud, the more natural they'll feel during real encounters. I used to literally practice transitions and explanations out loud in front of a mirror because it helped me notice any awkward phrasing, rushed transitions, filler words, and moments where I sounded uncertain. that practice really matters. If you want to see this communication framework applied to OSCE style scenarios, check out the full video on my YouTube channel, ScrubNotes. That video walks through these sound bites step by step and shows you how to sound more organized, confident, and professional during patient encounters. So if hearing the framework helped, I definitely recommend watching the visual version as well so you can see how that flow fits together in real time. Thanks for listening, and I hope I see you in the next episode. And if you know someone who knows the medical but struggles with what to actually say in the room, please share this episode because that's exactly what this podcast series is designed to help with. That's it for today's episode. Great job showing up and putting in the reps. Whether this felt easy or a little uncomfortable, that's exactly where growth happens. This isn't about memorizing scripts, it's about building a system. If you found this helpful, take a second to follow or share it with a classmate. Let's make clinical communication a little less stressful for everyone. Thanks for listening, and keep practicing. You got this, future doc.